Hello everyone and welcome back to my YouTube channel. Today I am going to tell you about a very important clinical condition known as prediabetes. As the name suggests, prediabetes is a metabolic condition which is characterized by blood sugar levels higher than normal but not high enough to be diagnosed as diabetes. The main risk of prediabetes is the development of type 2 diabetes in near future. So how common is prediabetes? Prediabetes is as common as type 2 diabetes. Currently there are more than 541 million adults with prediabetes worldwide. That means practically 1 in every 9th adult is having prediabetes. So what are the risk factors for prediabetes? The main risk factors, they include age more than 30 years, then family history of type 2 diabetes, obesity or overweight, sedentary lifestyle, presence of high blood pressure and high cholesterol, and history of polycystic ovarian syndrome in women, and smoking. So, what are the symptoms of prediabetes? Unfortunately, most of the people are asymptomatic. But occasionally, some people may face some symptoms like symptoms of low sugar or hypoglycemia, though the sugar levels may still be normal. And this is due to presence of insulin resistance, which is the key driver in development of prediabetes. These people have high levels of insulin, which can bring down the sugar levels, and people may feel the symptoms of low sugar, but it is not necessary that they will have low sugars when they check it. Then some people, they may feel the symptoms of increased thirst, increased urination, and fatigue. Now, what are the complications of prediabetes? The most important complication of prediabetes is the development of type 2 diabetes. The second most important complication is cardiovascular problems in form of heart problems, stroke, and other cardiovascular diseases. Now, this is very important to remember that people with prediabetes has similar risk of development of cardiovascular problems like people with type 2 diabetes. Then very rarely these people may develop nerve problems or neuropathy, and eye problems or retinopathy. So how is prediabetes diagnosed? Prediabetes is diagnosed by doing 3 blood tests. One is fasting plasma glucose after an overnight fast of more than 8 hours. Number 2 is oral glucose tolerance test, in which after collecting the fasting plasma glucose sample, the person is given 75 grams of glucose, and then 2 hours after that another sample is collected for plasma glucose. And number 3 is HbA1c or glycosylated hemoglobin A1c. Now, if any one test is abnormal, person is labeled as pre-diabetic. So, for diagnosis of prediabetes, HbA1c should be more than 5.7 to 6.4. Fasting plasma glucose should be 100 to 125 milligram percent. Our oral glucose tolerance test 2-hour value should be 140 to 199 milligram percent. Now, if suppose somebody is having high fasting plasma glucose, he is labeled as impaired fasting glucose person. And if the 2-hour value is abnormal, this is known as impaired glucose tolerance. Now, what is the risk of development of type 2 diabetes in these people with prediabetes? Up to 70% of people with prediabetes may develop type 2 diabetes in 10 years' time. The annual risk is 5 to 10%, and the risk goes up if somebody is having impaired fasting plasma glucose and impaired glucose tolerance both. Prediabetes can be managed by adopting healthy eating habits, and the diet should be balanced and healthy. And these people should avoid sugars and refined carbs, processed food, and saturated fats. Then maintaining a good physical activity regime, 150 minutes of moderate intensity exercise per week is good enough to prevent diabetes. Then maintaining the healthy weight, or trying to lose 5 to 10% of weight if that person is overweight or obese. And stopping smoking, and in some high risk cases, metformin can be prescribed. And then regular checkups are required to assess that when you are taking these lifestyle measures, what is happening to prediabetes. So I would like to conclude with some key takeaways. Prediabetes is as common as type 2 diabetes. Most of the people are asymptomatic. Unhealthy lifestyle, overweight and obesity, and family history of type 2 diabetes are important risk factors. It can be diagnosed by 3 blood tests: fasting plasma glucose, oral glucose tolerance test, and HbA1c. The most important complications are development of type 2 diabetes and cardiovascular problems. Fortunately, it can be managed easily by optimizing the lifestyle, losing weight, and avoiding stopping smoking. Only very small number of people will need medication to treat it. So thank you for watching, and if you have liked this video, don't forget to share, like, and subscribe so that more and more people can be benefited. And if you want me to cover any specific topic, please mention in the comments.